Alright, so I've already talked about this a lot on a couple of streams that I've done within the past week, and I've made a Facebook post about this already, but I wanted to just quickly record this short video because I find that video is often the best way that I can use to get my point across. So, real quick, for a few minutes here, I want to cover what the experts and authorities and science is saying on masks' efficacy at preventing the spread of viral infection in the community, and then I want to have a look at what the actual guidelines and expectations are for the city of Winnipeg and surrounding area, whether that be for the individuals and the customers or whether that be for the businesses and the owners and the employees. So, we're going to start by looking at what 3 major health institutions have to say about the spread of viral transmission and the use of masks. This is from IPAC Canada, that is the Infection Prevention and Control Canada group. This is under measures to reduce the spread of influenza. It says right here, there is no evidence to suggest that wearing masks will prevent the spread of infection in the general population. Improper use of masks may in fact increase the risk of infection. And this is one of the main things that I have been hearing people complain about since day one of the whole mask thing, is that people aren't wearing their masks properly. So according to IPAC, Infection Prevention and Control Canada, not only is there no evidence to suggest that wearing a mask will prevent the spread of infection, wearing the mask improperly, which I hear most people do these days, or a lot of people at least do these days, may in fact increase the risk of infection. So that's from IPAC Canada. And now we're going to pop over to the CDC's webpage here, cdc.gov, and we are going to highlight this big chunk here, and we are going to read until here. It says, while research indicates masks may help those who are infected from spreading the infection, there is less information regarding whether masks offer any protection for a contact exposed to a symptomatic or asymptomatic patient. Therefore, the determination of close contact should be made irrespective, which is just a fancy word for regardless, which means it does not fucking matter whether or not the person with COVID-19 or the contact was wearing a mask. Because the general public has not received training on proper selection and use of respiratory PPE, it cannot be certain whether respiratory PPE worn during contact with an individual with COVID-19 infection protected them from exposure. So this is the CDC saying that masks don't guarantee you protection from exposure, and again, the general public has not received training on proper selection and use of respiratory PPE, which if you'll remember, according to IPAC, means that improper use of masks may in fact increase the risk of infection. So, with a lot of people wearing the masks wrong and not being trained properly on how to use them right or select them properly, implementing mandatory masks could very well be doing more harm than good, according to these 2 sources. But I have one more to go. This one's probably my favorite statement of them all. This is from the WHO. The World Health Organization. We're going to read this whole section here because it's all very relevant. What is the WHO's view on masks? Masks should be used as a part of a comprehensive strategy of measures to suppress transmission and save lives. The use of a mask alone is not sufficient to provide an adequate level of protection against COVID-19. You should also maintain a minimum physical distance of at least 1 meter from others, frequently clean your hands, and avoid touching your face and mask. This right here kind of speaks to another of the main complaints that I have been hearing since day one of people wearing masks, is that a lot of people seem to think that as soon as they put the mask on, they are good. They get a false sense of security and they think that they don't have to follow any of the other protocols, whereas it says right here on the WHO website, even if you are wearing a mask, you should absolutely also maintain the other protocols for helping to mitigate the spread. We are going to continue reading. Medical masks can protect people wearing the mask from getting infected, as well as can prevent those who have symptoms from spreading them. The WHO recommends the following groups use medical masks: healthcare workers, anyone with symptoms, people caring for suspected or confirmed cases of COVID-19 outside of healthcare facilities. Medical masks are also recommended for these at-risk people, people aged 60 or over, and people of any age with underlying health conditions. Notice it doesn't say anywhere in this whole section that the WHO recommends mask use in the public for the entire population. It's these specific groups that they mention. And here they really drive the point home. Non-medical fabric masks are being used by many people in public areas, but there has been limited evidence on their effectiveness, and WHO does not recommend their widespread use among the public for control of COVID-19. So, IPAC, CDC, WHO, all saying we have no evidence to conclude or support the fact that masks help prevent the spread. We have evidence to prove or suggest that wearing masks improperly may make the spread worse, and we do not recommend the use of masks on the general public to prevent the spread of transmission, according to the WHO. So they don't recommend the use of mandatory mask use for the general population, just for the at-risk groups that they mentioned again here. Improper wearing of the mask can in fact make things worse and make the spread worse. And the CDC admits that the public hasn't received proper training on wearing and usage of these masks and PPE. So again, like I said, there is a fair to good chance that these mandatory mask rules that Winnipeg and Manitoba are now implementing could very well make things worse instead of better. Now, all that being said, are there ways to get away with not wearing a mask? Absolutely there are. We are going to pop over now quickly to the City of Winnipeg and the Province of Manitoba web pages respectively. This is on the ongoing response to COVID-19 page for the City of Winnipeg under the FAQs section. Question number 5. Do I need to prove that I am exempt from not wearing a face mask? And the answer is no. All persons are expected to make good personal decisions regarding use of face masks and would not be expected to provide evidence to support their decision. Members, this one especially is not only for members of the public, but for the business owners and store owners and employees as well. Especially, members of the public will not be denied service for not wearing a face mask from the City of Winnipeg. Also, the City of Winnipeg is not responsible for enforcing public health orders. That responsibility is the Province of Manitoba's. So it's not up to the City of Winnipeg to enforce the rules. It is not up to the business owners to enforce the rules. It is up to the Province of Manitoba to enforce the rules. Now, that being said, we're going to pop over to the Province of Manitoba's website. And again, this is on the COVID-19 prevention page from the Manitoba website, Manitoba government website. And we're going to again scroll down to the FAQ section, frequently asked questions. We're going to go to the guidance for proper mask use subsection. And we are going to read who should not wear a mask. Last updated September 17th, 2020. They go into pretty good detail about who specifically should not wear a mask, but I want to really focus on this last paragraph here. It says, if you are concerned about your ability or the ability of someone you care for to safely wear a mask, please speak with a healthcare provider. If you or someone you care for is either unable to properly wear a mask or have a medical condition that does not allow you to wear a mask, a doctor's note or a note from another healthcare provider is not required. So, to recap, before I leave you here real quick and go back to my business, according to IPAC, CDC, and WHO, they have little to no evidence to support the fact that masks help prevent the spread of the virus. And in fact, both IPAC and CDC admit that the general public has not received proper training on selection and use of PPE, and improper selection and use of PPE could in fact make the risk of infection worse. So we could very well be making things worse instead of better by mandating these masks here in the City of Winnipeg and the surrounding area. But if you are concerned about that, you can follow these links that I showed you here to go to the the FAQ pages, and you can see from both the City of Winnipeg and the Province of Manitoba that you are definitely to be allowed to be medically exempt from wearing a mask, and it is not up to either the city or the Province of Manitoba or the businesses themselves. They have no right to force you or to coerce you into providing proof or documentation of that medical exemption. So you can say, I am medically exempt. They cannot ask you to provide proof, and it is not up to the City of Winnipeg or the businesses themselves to enforce these rules at all. It is up to the Province of Manitoba. So I hope that was informative. I hope that helps you kind of feel a little bit better if you were feeling a little nervous or anxious about the mask use in general, whether you disagree with the mandatory nature of the mask rules or whether it's just the simple idea of wearing masks in general that is making you anxious and fearful. I hope this kind of helps you feel a little more confident and a little better, because we've got statements from 3 major public health authorities saying that we have little to no evidence to support that masks work in the first place, and we have statements from the City of Winnipeg and the Province of Manitoba saying you are not required to wear a mask and you are not required to prove medical exemption from being able to not wear a mask. So you don't really have to go along with it if you don't want to, is basically the gist of what I'm saying. They don't have any evidence to support that the masks work in general, and both the city and province have said that we're not going to ask you to provide proof of any sort of exemption from wearing a mask. So, again, you don't have to wear a mask if you really don't want to. There are very easy, reasonable, legal ways that you can, within your rights, get away with not wearing a mask if you choose not to, for whatever reason. So, I hope that was informative for you guys. If you liked this video, please like the video and then go to my channel, subscribe, turn on the notification bell so that you get notified when I put up new videos and new content. And then if you could also head over to my Facebook page, Media Windog Watchapeg, and leave me a like and possibly a review and a rating there. I would really appreciate that as well. I'll be back for more videos and more content soon. So you guys have yourselves a great day, and we will talk later. Ciao, ciao.